later the evening reception with some drinks and some food, but this was the very last coffee break, and we now move over to our session. So just to give a little thank you once again for everyone for joining the simulation exercise, and we have just seen that mental health is actually also quite an important topic in conflict settings, but also elsewhere. So this is a very good introduction for the next session, coming now from my colleague.
Thank you, Katrin, and welcome back, everyone. Yes, mental health. We mentioned it many times now during the day that this session will be about mental health and also NCDs, because actually it's part of a queue of activities, so to say, we are implementing at the Global Health Hub Germany towards the UN high-level meeting on NCDs and mental health this year in September. Mental health has been overlooked, a blind spot in global strategies, in global NCD strategies, but also in service delivery, as we just learned during the simulation exercise. At the same time, evidence suggests that cases are rising, mental health challenges are rising, especially in the youth among adolescents. And as we heard this morning, young people are using ChatGPT now to get mental health advice. So something is really going wrong. In the next panel, we want to look at it a little bit deeper. We have very exciting, amazing experts on the panel. But before we do that, I want to briefly explain this flame to you that you see here on the empty chair, because we will not let you rest. Don't think that we are done with interactive formats. We have one more for you, because mental health affects us all. It's a topic for us all. And there would be so many voices that I would like to hear speak on the topic. I would like to hear someone with real experience with a disease who's willing to share their story. I would like to hear young people telling us what actually happened during the pandemic. How are you feeling? What are you missing? I would like to hear policymakers to understand the challenges in implementing impactful mental health policies. But we can't have them all on the panel. Otherwise, we would keep you here until next week. And therefore, we decided to put a hot seat here on the panel. So this is a seat for everyone who thinks, hey, I have something to say, I want to join the discussion. Our moderator will open the hot seat situation later, so then you will know when you are invited. And since we are talking about young people, especially in this upcoming panel discussion, of course, the first invitation goes out to our young people in the audience, to the youth, and I let you yourself decide if you count yourself to that or not. So, but now, let us get started. I want to introduce our amazing moderator. You already have seen her on the stage today, and that is Sarbani Chakraborty. Sarbani, please already come on stage. Yes, a round of applause. Sarbani worked 17 years with the World Bank, focusing on health sector reforms in various parts of the world, and subsequently worked in the pharmaceutical industry. She's a global health researcher and policy entrepreneur with extensive experience in health policy and health financing. And currently, she works at the Center for Global Health at the Technische Universität Munich, amongst others. So, Sarbani, over to you, and everyone enjoy the session.
Okay, can you hear me? This is the afternoon slump, right, isn't it? So I'm going to take my privilege as the moderator, and given this is the NCD and mental health panel, to get all of you to stand up and do whatever it helps you. Do a happy dance, do anything that makes blood flow to your brains, okay? Take your time, do it, enjoy. I wish I could have some merengue music, but I don't have that. But do your merengue in silence. Exactly. Cumbia, salsa, anything. Good. Okay. So are we ready? Okay. Let me first invite my amazing panel. First, I would like to invite Professor Dr. Caroline Cohrdes from the Robert Koch Institute to join us, please. I'm going to tell you more about each of our panelists. Next panelist is Gabriela Nasser. She comes from Brazil and represents civil society. And then I see there's a Latino crowd here. And then Vanessa Pott from Boehringer Ingelheim. I'm going to tell you more about our panelists. But let's get started. I prefer to stand a little bit before I sit down. But now let's get down to serious business, and the serious business of NCDs and mental health. This is a global crisis, and there couldn't be a better time for us to be meeting here today in Berlin to discuss this. And why do I say that? Because in a few months, the global community and member states will be convening in New York for the third high-level meeting on NCDs. Now, I emphasize the word third, and it probably says two things. NCDs and mental health are very important, right? But it also says something else. We are not making progress. We are far behind in achieving the Sustainable Development Goals on mental health and NCDs. And so we all need to accelerate action. What happened in 2018 at the second high-level meeting was revolutionary. For the first time, the global health community recognized that NCDs is also about mental health. It wasn't part of the NCD agenda before. So from 2018, we have been talking about mental health, but we have been adding certain other things to it, neurological disorders. And so now within the academic community, and I'm looking at my colleague, Professor Winkler, we are starting to call this brain health. It's a comprehensive approach, life course approach, to looking at how the brain is doing even before a child enters the world, right up to the time that you're an older person and you probably have dementia and Alzheimer's. But today, let's get back to the point about a global pandemic, which is children's, youth, and young person mental health. The Lancet Commission on Youth and Mental Health and Well-Being last year said, this is a very serious crisis. And what's more important is this is the future of any country. If this group falls behind because we didn't do anything about their mental health, it will impact our societies, our economies, families. So let's now get into the business of asking our experts, what is the state of the world on youth mental health and what we can do about it? And now I'm going to sit down. Okay. So Dr. Caroline Cohrdes is senior researcher and deputy head of mental health research unit at the Department of Epidemiology and Mental and Health Monitoring at the Robert Koch Institute. The Robert Koch Institute needs no introduction. So, Dr. Cohrdes, I would like to start with you and actually bring you back home to Germany. What are you seeing in terms of the trends in youth mental health? What has been changing in the last couple of years? That's my first question. And then also, if you can help us understand, what are some of the factors and determinants that are driving these changes? So over to you, please. Thank you.
Yes, so do I have to press?
You have to press?
Okay.
That looks great. Okay. Yeah, thank you very much for the invitation. I'm very happy to talk a bit about this very important topic. And, well, I think this may come to not as a surprise for you, but the trends in mental health problems in Germany are increasing over the past years. So when we look on the evidence on population-based studies or also from healthcare data, so like medically coded diagnoses of mental disorders, this is reflected in the numbers too. So we see over the past years an increase, and more concretely, this particularly affects depressive symptoms, anxiety symptoms, and eating disorders. And this also particularly is the case for late adolescent girls and in general young adults. And this is quite a worrying development. And what I can tell is that there was a peak during the COVID-19 pandemic, and this was in 2021. So we then recognized that about 30% of the young people experience symptoms of depression or anxiety. And after that, there was a kind of a decline, so we have a bit smaller or reduced numbers by the end of 2024, but they are still very high, so they are about 20 to 25%. And we are far away from reaching the baseline level before the pandemic. So the numbers are still double, you can say. So they doubled kind of ever since. Yes, then maybe I come to the factors, because beside, of course, this worrying information, there are opportunities to overcome this, because not all of the people with symptoms are necessarily developing disorders. And that's where some protective factors or resilience factors play a crucial role. And of course, it's always a bit complex, so there's a complex interplay of different factors. I have to say first, there's not the one and only solution, as all of you may already know. But just to mention some of the most important factors that are currently discussed as potential causes of this trend. Those are problematic social media use, multiple crises, and stigma, mental health stigma, and of course the long-term effects from the pandemic, by which I mean loneliness, social isolation, deficits in social, reliable relationships, support, and so on and so forth.
Thank you so much for that. So I think you're helping us see that in Germany, for example, it's almost like an epidemic if the numbers are so high. And the second thing is OECD published an excellent report last year on youth mental health in EU countries, OECD countries, and in EU it's the second highest cause of mortality among 15 to 29-year-olds is suicide. And that is very, very serious, obviously. So thank you for that. Maybe I'll come back to you later to hear more about what we can do about it. Let me move to Gabriela. Gabriela is actually vice president of Instituto Melhores Dias, which in English means, actually, it's a really nice name, it means happy days. And she is running this at the community level in Brazil, where, Gabriela, we know that Brazil is a country of contrast, right? You have very rich people, you have poor people, and you're working in some of the poorest communities. So tell us a little bit about what are you seeing in your communities when you look at the children or at the youth, and is mental health an issue in your communities? Over to you.
Yes. So thank you, Sarbani, for the question. Thank you also, the Global Health Hub, for the invitation, taking part of this panel. It's an honor to be here, first representing Brazil, and also the voice of civil society. We've seen in the panel before, I think, working on the ground, we see a lot and we feel a lot, and it's always important to talk about it. So no matter how it is. So yes, at a community level in Brazil, we observe also a strong but often overlooked link between mental health conditions and risk factors for NCDs. And this is something that is shaped, of course, in Brazil, as you mentioned, by several layers of vulnerability. So poverty, social exclusion, and food insecurity, all this plays a part as well. Brazil has now, I think, over 50 million people under the age of 18. Latin America is also facing this trend. We have a very young, it's the largest, youngest population in Latin America so far, which gives us an opportunity if we would, now focus on actually growing healthier adults. But what we see is, of course, following the global trend and German trend, we see higher rates of suicide. which in Latin America wasn't so big, but now it's the third, actually in Brazil, it's the third motive of death among youth. We see higher hospitalization rates due to self-harm and, the minor psychiatric disorders as well as anxiety, depression. This is all growing. The problematic part that I would also bring is that these conditions are not don't come in isolation. So you always have with it, often have with it, alcohol use and abuse, which is pretty heavy in Latin America. You have extreme exposure to violence, in communities such as we know in favelas in Rio de Janeiro and other places where youth, the highest actually, Brazil has one of the highest homicide rates in youth in the world. This is all very troublesome in terms of mental health. And it was brought up also on the first panel, adolescent and teenage pregnancy. For girls, this is a huge issue in Brazil. We have regions where it accounts for almost 18% of all births, which is very high. And they don't have, the resources and education and mental health support that you would expect. So this is like a puzzle. All these factors play a part in not only increasing mental health burden, but also presenting a challenge to our work in everyday, in the everyday field. But, communities also present opportunities, and then we can also talk about a little bit that later, a bit of hopefulness and what we have seen on the ground in terms of action. So thank you.
Perfect. So let's continue the story. So we went from Germany to Brazil, and we are starting to hear about global trends. This is happening everywhere. But now let me complicate the story for you a little bit more. Hopefully you've had enough coffee and you're awake for the second part of the story. And the second part of the story is that when we talk about mental health, it's not just mental health in isolation impacting our youth. There is also a deep bidirectional relationship between non-communicable diseases and mental health, and vice versa. So somebody who is suffering from cancer has a very high chance of developing depression and anxiety. The data shows that young people who develop cancer are at very, very high risk of depression and anxiety. It's the same with diabetes. What happens is when people live with a chronic condition, it brings with it the risk of developing mental health. And vice versa, if you have a mental health condition, such as schizophrenia or bipolar disorder, you are more likely to develop the other comorbidities like diabetes. So I would like to turn to our last panelist, Vanessa Pott. So I would firstly like to introduce you a little bit. Vanessa is the head of global patient engagement at Boehringer Ingelheim. Boehringer Ingelheim is a pharmaceutical as well as animal health, as we found out. It's a One Health approach at Boehringer Ingelheim, and they have been working for many, many years on various NCDs, including mental health. And Vanessa shared with me a very interesting fact this morning that for the last 15 years, Boehringer Ingelheim has been investing research funds into improving the treatments for mental health. So it also gives you an idea of how complicated it is. But I would like to turn to Vanessa from her perspective, working on global patient engagement and partnerships, to tell us is, from your perspective, Vanessa, how do you see this bidirectional relationship between NCDs and mental health being played out in the work you're doing?
Thank you so much, Sarbani. So thank you, everyone, for letting me come in with a few considerations from Boehringer. So yes, as you already pointed out, we are a pharmaceutical company. And so when we say patient engagement, what that means on the one hand is integrating systematically the perspective of patients, but also their family members, caregivers, into our drug development, right? So this is one aspect of my work. But another really important aspect is that we strongly believe that co-creating and co-designing products and having that perspective of the end user, if you want to call it that, the person with the lived experience captured, it's not going to serve anybody if those innovations don't reach patients that need them desperately, right? So a second very important pillar of my work is related to advocacy and working in partnership with mostly patient organizations, but not only, and I will come to that in a moment, to really help shape access to treatment and care, and that in a holistic manner. And I said mostly patient organizations, but as you can imagine, a lot of people that are affected by chronic conditions, by mental health conditions, they don't necessarily find themselves in patient organizations. I think that's a very idealistic view of the world, too simplistic. We really need to make sure to be able to reach underserved populations that we also go to where they are. So one of the latest partnerships that we have actually started is in the United Kingdom with the African and Caribbean Health Network. So just to give an example where it's not, of course we also work with, for example, the Diabetes Organization or the Cardiovascular Group or cancer organizations, but we're trying to take quite a holistic approach there, yeah. And you brought up this topic of the interconnectedness, and actually I would like to highlight that that is actually something that we really believe very strongly needs to find its way into the political declaration in September, but also that I need to unpack a little bit what mental health is, because I think it's easy for governments, for policy plans to fall a little bit short of the complexity by just focusing on mental health as a term as such. We need to recognize exactly what you were talking about, that there are serious mental health conditions, schizophrenia, bipolar, PTSD, borderline, that often get overlooked. And I'm not saying that one is more important than the other, but I do want to stress that it's very important to capture that entirety in the political declaration and make sure that there really are commitments from the national governments at the UN meeting that then get translated and implemented back locally to benefit not only people living with NCDs who are affected by mental health conditions, anxiety, depression, loneliness. All of that is incredibly important, but I do also want to shed a light on people living with serious mental illness as well, because we know, as you were saying, that they have such a high risk of developing comorbidities such as obesity, diabetes, etc. And actually, data shows that on average, people with serious mental illness die 10 to 20 years earlier than their average peers. So this is very near and dear to my heart. As a company, if I can just talk a little bit about what we do concretely, just wanted to highlight that in my role with our work in patient engagement, we actually try to bring all of this complexity into our work by regularly interacting and engaging with patient organization leaders, with individuals with lived experience, and we do this sometimes in traveling quite far into quite remote areas as well, and so this helps us get really a much broader perspective, not just geographically, but then also when we talk about age, for instance. So today we want to highlight a little bit more the plight of the youth in this, and I think it's very important that the voice of youth is also heard loud and clear in this process.
Thank you so much, Vanessa. And I think one of the things I hope you will leave this session, I hope you will agree with me that we all need to be mental health advocates, because it is a cross-cutting theme, irrespective of whether you work in HIV/AIDS, malaria, TB. You know, in global health, we sometimes tend to think in silos or diseases, but mental health somehow seems to cut across all of these elements, which is why mental health needs to be embedded, right, into the health system. So with that transition from the current state of the world to what do we do about it, let me first come back to Carolyn again and ask, so what do you think, Carolyn, are the current strengths and limitations of the integration of mental health into NCDs? Over to you.
Yeah, well, at first, I think one main challenge is that still it's very rarely that mental health is a systematic, continuous approach within NCD surveillance systems. So especially in the European countries, it's not yet very common. And so we were very happy and delighted to get the chance to build up a mental health surveillance system in Germany. We started developing that in 2019. And so we, after that, then started to step by step implement mental health indicators in that ongoing surveillance system. So that's really great. And the benefits, I think I have to point out, are that we are able to monitor changes very timely. And we very timely are able to point at certain vulnerable groups or to point out where people seem to need help. And this is very beneficial, I think, and a good solid base for the informed decision making and planning and allocation of resources and so on. And of course there are some challenges still. One challenge is that we started with adults, and we are putting the same system now into place for children and adolescents. It's a bit more complicated. And it's also difficult at some points to reach representativeness, for instance, in case of hard-to-reach groups. So what is about the homeless people? What is about all the people with migration history? What is about the socially disadvantaged people? So that are still some challenges we have to push forward.
That's very interesting because, as you said, mental health manifests itself different ways among different groups. So, we need to be very targeted in our approach, and we need to have the data to guide our decisions. So, Gabriela, coming to the community level, I mean, that is one question I have for you, because with mental health, there's a lot of stigma, right? People don't want to talk about it. In your work at the community level, how are you engaging with communities, and how are you also linking mental health to other risk factors? Like you said, there's alcohol, there's domestic violence. Can you give us a few examples?
Yes. Well, Brazil has, as many of you may know, a very well-established national health system, very much based on the community and primary healthcare services. And we've had in the last decade actually invested a lot in these psychosocial centers that are available in most of the municipalities, not all, and we know that it's not it's not perfect, but these psychosocial centers are actually places to open, and there are some that are specific to young teens and children. And they are embedded within the primary healthcare system. So when a person comes to the primary care and they're accompanied by the healthcare workers that go, they know already the families. If they see that the child or teen has a problem, they are then sent to these psychosocial centers that they're treated for either if it's alcohol or drug problem or also a mental health issue. At the NGO, and I think this is the beauty of the civil society work and NGOs, we actually play a part of intermediating between the community, the government, and whoever the private funder, if there is one. Because, and I think this was mentioned also before here today, and this is, I think, the real challenge, the sectors don't talk to each other. So the school doesn't talk to the health, doesn't talk to the development sector, nobody talks to each other in the community. And when you come from outside and you see that these different players are trying to tackle the same problem, it's like putting children, let's sit down everyone and discuss what the solution should be. And this is what we've seen as the major challenge, is actually, looking at the problem and seeing how locally you can find a solution with the resources that you have. But other examples that we implement simple things, for example, school gardens for teachers, because we saw a lot of testimonies from teachers that they've been having kids that have been diagnosed with autism or different types of psychosocial disorders, and they're not ready to deal with it. They get a letter from the mother saying, 10 a.m. you have to give this medication. That's it, deal with it. And the schools are not prepared, they're not ready, and sometimes having a simple tool such as a garden where the child can actually have a different type of action than just sitting in the classroom is something that the teachers can use as a, So, thanks.
That's a perfect NCD example, right? Grow your own vegetables, be in fresh air. That's a great example. So I think I try to connect the messages here. On NCDs and mental health, we have known always that it has to be multi-sectoral. We need to work with different sectors. And in fact, one thing I learned working on health financing and NCDs, there is no money in NCDs and mental health. Not a single dollar of USAID money or Global Fund money. Nobody was investing. So what actually happened, and I've been working in NCDs for the last 12 years, and always trying to figure out how do you do financing, and public-private partnerships were always a way to drive that change because there simply wasn't any money. So you looked around and said, let's work with the public sector, the private sector, bring everybody together. And so, Vanessa, I want to turn to you and ask you, from your perspective, how do you see the role of public-private partnerships? And also if you can tell us of some things that Boehringer Ingelheim is doing, and how these examples could be shaped for good practices, for example.
Yeah, and that's, I think, is very important, the last point that you just made about shaping the best practices so that they can also be transferred, right? So you asked about the role of public-private partnership, and of course, I mean, I mentioned already, this is a part of my work as well, and is very important, but I do think, it is a shared effort, so I also really call upon the governments and policy actors to actually commit and increase funding, for sure. I also call upon other private sector actors as well to join us in this journey. Boehringer has been very active. We also stand in I want to say, somewhat unique position in that we are a private company. The name Boehringer actually is of the Boehringer family, and we were founded in Ingelheim, a very small German town. So it is a bit of a unique setting because of all the big pharma companies, top 15 companies in the world, we're the only one that is not in the stock market, So we follow, I want to say, a more long-term perspective, and really with an ambition to transform lives for generations ahead. And so I think this aligns a lot with public-private partnership because it is a long-term thinking and perspective until you can actually see tangible results and outcomes. We do this in a few different ways. What is important for me to stress is that it's not just about, two things actually. So on the one hand, it's not just about supporting our commercial interests. I really do believe that pharmaceutical industry as a whole, this is not specific to Boehringer, but that we have a duty to go beyond providing products to really becoming a strong health partner. So that is one aspect that I think is very relevant. But on the other hand, it's also more about just donations. So it shouldn't be just one directional. We also emphasize a lot of capacity building, transfer of knowledge, also from within our company, supporting with data science initiatives, for example, to help also with collecting the evidence and data, because this is very important as well, that there is that feedback loop and that we can adjust. Some specific examples, and I want to give a few different ones just to show the variety of the work that we do. So recently we entered into a multi-year partnership with the WHO Foundation. We donated $5 million specifically to support through a fund work in the Americas on suicide prevention. And the suicide prevention projects are actually quite multifaceted, ranging from healthcare system strengthening in the Americas down to very tangible things such as media trainings and working with journalists on sensitizing them to stigmatizing language and the better use of language to overcome stigmatization of mental health conditions in the region. This is something that we have also done in Germany, for example, with working with journalists, trying to address stigma in that way. Another project, completely different, not this sort of large-scale multi-country, multi-year project, but is really our ongoing commitment to a very small grassroots organization in Zimbabwe that is actually making internationally a big name for itself. So some of you may have come across the Friendship Bench. It's an organization that is very simple in its approach, does not require high level of resources to work. It literally just needs a bench in a village, and this is something that Dixon Shibanda started, where benches are installed in local communities, and grandmothers sit on these benches. This also connects with their culture of storytelling, and anyone can sit down next to the grandmother and just talk. And this is a very low barrier, low threshold mental health intervention that they actually are successfully now also rolling out. And Boehringer is supporting here with a very interesting transfer of a project from the global south to the global north, so to speak, because we're supporting this organization and bringing this model to the United States and rural populations in the United States, where there's also a long distance to overcome, for example, to access and see a therapist. And just finally, a third example, which again takes a completely different angle, where it's not with the grassroots, but actually with, in Japan, some work that we have done there is in terms of working with our data expertise as well, supporting local prefectures. This is like the local level of health administration in Japan, to work through data from health claims and to actually encourage and support the faster discharge of people from long-term hospitalization because of their serious mental illness. In Japan, there is a strong culture of long-term hospitalization and helping and supporting people move faster into community-based care, just to name a few.
These are great examples, and I mean, the Friendship Bench has been talked about a lot, but what it also reflects actually is a serious lack of trained healthcare professionals, mental health care professionals in sub-Saharan Africa. And therefore, the approach is using innovative approaches, and grandmas can be one of them. And I know from my kids that they talk to their Oma much more than they talk to me. So there must be some magic in the Omas that, so I just mentioned to Vanessa, that could work in Germany as well, because I see my children saying things to Oma that I have never heard about. So
I mean, at the end of the day, if I can just jump on there, I think often, just human connection and just enabling opportunities for exchange in a world where more and more people are moving through life in isolation, I think that would actually go a long way as well, yeah.
That's a great comment, because I think last week you have seen that WHO released a report on the impact of social isolation on people's health. It's a report really worth reading. It makes our public health world much more complicated. But in a way it should make it simpler, right? To go back to the roots of communities and people and talking to each other. So talking about talking to each other, now we are ready for the hot seat. Are you ready for the hot seat? So do we have a youth volunteer who would, please? And we have a second, so I'll call upon you next. Please join us.
Yeah, thank you, everyone. My name is Malte. I'm with University's Allied for Essential Medicines, and I wanted to tackle the issue of information, or rather misinformation, that many young people are subjected to, because we frankly just lack a way to get information on mental health, And as young people, then we often look to social media, of course. And social media can be great in getting information, but also very often subjects people to a lot of misinformation. So on the one hand, I can have friends who found out that they might have ADHD through social media. On the other hand, other friends can be subjected to just very grave and dangerous misinformation, because there's no real, or at least no working effort from official sides to reach young people with information on mental health that reaches us, that is understandable for young people, and that works to show what is right, what is actually working, and what is misinformation from third parties that maybe don't always have our best interest in mind.
Thank you, Malte.
Thank you for sharing that. Thank you. Did you have a question?
Yeah. No, can I would like to also... No, please. I want to agree, and on top of that, I would say that I think that youth and teens are usually and often overlooked within the global health agenda, because it's not a population that goes to a clinic. We don't search for doctors. We're majority healthy. We keep, if you keep a healthy diet and if you do exercise, why would you even check? So I think there's also a work from the side of, you're right, of the, who works with public health and doctors to actually think about how to reach, because as we've discussed, the sooner you intervene and the sooner you give information, these habits for, adult and old age are mostly for NCDs begin and mental health in youth. So thank you, I agree with you.
Thank you for sharing, Malte. And I think we have another volunteer. Please, welcome. You had a question. So do we have a second volunteer who would like to be in the hot seat? I think you can ask your question or join us here to ask your question.
Thank you. So I think my question is to the three presenters and the moderator. Excellent conversations here. I wanted to know, what would you advise countries to do, especially countries that would like to now start integrating mental health into the primary health care? Because there's issue of, like, for example, in Africa, issues training. They are not trained mental health experts. Most of them are also in the urban areas, in tertiary institutions. There's also, how do you evaluate outcomes? Because this is chronic. As I think one of the speakers said, it's unseen what is happening, and the same way, the impact, you can't really feel it now. You feel it like in the long term. So how do you also evaluate it in the interim while you are getting to the long term? And how do you get resources, financial resources, because you can't count, like if it's number of lives saved from malaria or vaccination, it's easy to count it, but how do you say, okay, I was able to help children with ADHD, and you are trying to inform a politician, he's looking at you like, what are you saying? So I think, how do we also drive resources, financial and otherwise, for it? Thank you.
Thank you. That's actually a perfect question. And I can kick us off by just making a few comments, and then I'll hand over to our panelists. So last year we did some work with United for Global Mental Health on the integration of mental health into NCDs. And one of the main findings of the work we did was that telling community health workers who are already overburdened to do more on mental health would not be the right approach. In fact, what WHO is looking at now is something called a collaborative care model, right? And in the collaborative care model, you have mental health workers that are a distinct cadre sitting within primary healthcare centers. But as a health financing person, when I looked at that, what it indicated to me, that it has resource implications. So going back to what Vanessa, you said, is that there is no getting away from investing more in NCDs and mental health and doing it right. There are no shortcuts, and the same community health worker who does HIV/AIDS, malaria, TB, telling that person to then take on mental health being is simply putting them in a difficult place. So let me this time go the other way around and maybe start with Vanessa for your comments.
I mean, look, I also don't have all the answers. I think your question was incredibly relevant, but one thing that I can maybe highlight is the importance of, so first of all, it's not just about the commitment that we're looking for in the political declaration, right? That's at the end of the day just a piece of paper. The implementation is incredibly important, but at the same time, my work has taught me that there is no one size fits all. And so I think ultimately, what is incredibly important is at national level is that national governments also work with their civil society, with people with lived experience, and actually formulating specifically to the local environment and maybe different environments within their country, right? Different settings, what the implementation plan looks like. But it does need to come with sufficient funding and measurement. And even if it's a small plan to start with, you know, there has to be funding to actually realistic funding behind it, and there has to be measurement. Otherwise, it's just a nice piece of paper.
Well, thank you. It's a very complex question. I would say, first of all, if, as Sarbani said, to get money for prevention of NCDs is hard. Prevention is hard. You don't find funding. So what we do, I mean, talking about civil society and NGO part, what we do is actually, I would say what NGO does is navigate funding areas. So this is, we go to where the funding is, of course, and I think in a way the private sector funding opportunity gives you a little more flexibility on the ground when you have a grant, let's say, to implement a project. Usually with a private sector funding, you have more liberty to adapt to what the community needs, which is harder when you're talking about governmental funding. But to address the issue of impact and how to prove, it's a really hard question. And for example, I've had in the past 3 years developed an alcohol prevention program with primary care workers focused on mental health and alcohol prevention. I couldn't prove what we did in the last 3 years. I have enough stories to say how much, and I know we've had an impact, but when we showed it to the mayor, he said, how many beds, hospital beds, can I improve? That's all they want to hear. So impact and numbers are very difficult in this sense. But of course we know how many, trainers, how many healthcare workers we've trained, how many, are more aware. There are tools that you have to measure how much more aware and ready they are to deal with these problems. So I think you can find solutions.
Okay, and I guess the floor is open for questions. And I think, Gabby, what you said is really important, because in public health and in global health, I think we have to talk more about storytelling. Because if we don't do that, we will be caught in this world where all you're capturing is hard numbers. So storytelling links to meaningful engagement and capturing those voices. And so in the spirit of capturing voices, let me open the floor for any questions you may have.
I think she was first.
Yeah, hi, and thank you for the interesting panel so far. I'm Judith Bock. I'm a master's student at the Berlin School of Public Health, and I also recently started to work for the German Parliament for Dr. Kirsten Kappert-Gonter. And I would be very interested to hear your opinion about mental health and restrictions of media consumption. So I know that in Germany we discuss a lot about whether there should be an age limitation for social media access. And yeah, I would really be interested in your opinion about that.
Thank you so much. I work as a client and community engagement manager at the Client Community International Rescue Committee. My question is regarding a specific group, which is migrants and refugees that, according to my experience, most of the mental health pressure that this group report and speak about is caused by politics and by policy making. So recently a lot of discussions on deportations and about restrictions when it comes to asylum seekers and migrant rights, a lot of discrimination, racism. They see what's happening globally, and I wonder if you have, through your work, any opinion on this topic. And my second thing is as well the role of media as a reason or a cause for more mental health issues through the exposure over a long time, but as well through the quality of media. And I'm speaking again regarding the specific group, which is migrants and refugees. Thank you.
Yeah, Veronica Dodero from Bielefeld University. Great panel. Thank you. I wonder what is the role of nutrition in this mental health discourse, and also the role of climate change. So because this impact in humans, we live here. So I don't know what is the role in this situation.
Hi, my name is Lea. I work at the Charité Global Mental Health. And I was also wondering what your take is on innovations in mental health and in specific digital health applications, because we were talking a lot about societies who are difficult to reach, and I think this might be an interesting take as well.
Already back. Maybe I'll divide up the questions among the panel. So maybe on the migrants and refugees, which is a very good question, maybe I'll turn to Caroline and ask that in your epidemiological surveillance, as you said, there are different target groups, etc. Do you see any data on migrants and refugees? Is that being tracked currently?
Well, at least to some extent, but of course, since we recruit our participants based on official registries, this is somehow a problem, of course. We have people with migration background and history, of course we have them, but it's not fully, it's not the whole picture, in short, unfortunately. There maybe are other institutions in Germany that are able to do that in more detail than we are.
And we also have within our Global Health Hub Germany, like Francesca was here before, Jinan as well works on. So I think this is something really worth connecting with them, because I think this is a critical issue for the country. We at least need to be tracking this group and seeing how they're doing, basically. Good point. Maybe on the nutrition and climate change as well, maybe more on the nutrition, Gabby, because you work directly on this, if you could tell us more.
Thank you about the question. Well, definitely we see a part. The pandemic has played a very big role in this. We saw right after the pandemic ended, many children in school couldn't stop eating. They ate nonstop, and we've heard this and we saw this, and the teacher said, I don't know what to do, stop. And I said, but I don't know if I'll have it tomorrow. And this was, when I saw it, it's pretty impactful. So you immediately see that there's, an immediate impact on because, you know, nutrition, everyday meals and everything, this also plays a part in your well-being. Not only what you eat, but how you eat. And what we see in Brazil, of course, it's very unequal. We said Brazil is huge. You have places where it's more structured. We have a federal school meal program that works very well in some places, and in other places, not really. So in places where the child doesn't have food security, doesn't have also a place, a safe and adequate place to play, to practice sports after school. This is all, you know, related to also her mental well-being. She's more like the child, not she or he, is more likely later on to have self-esteem issues or anxiety or even drop out of school. Of course, there's no causality. I'm just saying it's a relationship that we see. On the other hand, as I presented here, simple tools such as a garden, a school garden, and I think in Germany you have in some areas also, not only you provide fresh food, the child that doesn't eat usually vegetables doesn't like it, it gets more used to eating it, but also it's a place where you create empathy, where they're outside and where they together, you know, grow food and then pick the food and then prepare it. It's such a simple thing, and you see all the steps, and you talk about climate change and you talk about nutrition. So definitely they're connected. In Brazil, I wouldn't say that there's so much this pressure in the youth of feeling climate as here you have, you know, the climate anxiety. We have, in terms of flooding and extreme weather events, that's really big. This is something else also. But yeah, I hope I answered.
Great. And I think the relationship between mental health and climate change is a big area of research now, and people are really trying to understand. But on your point on changing children's behaviors, it's interesting, there's been studies done that when children change their eating habits in school, they go home and start telling their parents that we need to eat differently as well. So there's a very good impact, but at the same time, if you look globally, we are not investing enough in school programs. So that is definitely an important area of policy intervention. Vanessa, maybe I can turn to you for talking about innovations that you have seen. You've already talked about the friendship bench, but anything else?
Sure. I also wanted to address, if I may, the question, I think it came from a woman called Jule in the back, about media and restrictions. Because I just wanted to share that we discussed a similar topic last year at Boehringer's own hosted mental health community summit. So we invited mental health advocates from around the world to join us and to learn from them, really, and to help us also understand how we can take better direction on some of these topics. And when we were talking about media and social media in particular, it's actually interesting. It's a bit more nuanced, I think, because I also was seeing the recent discussions around restrictions, and what I heard from the community advocates that we work with in mental health. A lot of them, of course, also point out the duality of social media. On the one hand, it can cause the spiral of mental health to spiral out of control because you're comparing yourself, because you're looking at the body image, or you are just consuming, but you're not engaging in healthy habits and lifestyles and personal relationships. So there is a lot of negative pressure. Then also the aspect of bullying and anything related to photographs and sharing and all of these horrible things that we are aware of. On the other hand, the positive side of social media, especially when it comes to mental health community and young people, and having a safe space where they can actually connect with others, where they can, without the formality of joining a patient organization, or without the hurdle of actually accessing a therapist, and this leads me in a moment also to the question about the digital innovations, where they can actually connect and share and find community through social media and Facebook groups, I'm very old, but yeah, but connecting online, this I think should not be underestimated either. And I don't know, it doesn't probably answer your question, but this is just what I heard from the community that we work with.
It's a mixed thing, you know, and I don't even know if I don't know how my son would respond if I said he's 24.
I mean, for me, to be honest, the answer really lies in literacy and education.
Yeah.
So educating, going into the schools, but also at home through the parents, educating our children, our youth, how to safely consume social media rather than restricting. This would be my approach.
Or have youth peer counselors who do that, youth to youth. And I think youth tend to go for things which are not government, you know, like this is endorsed by the government, and they're like, it's probably not, it's very boring, probably. So we have to think, I mean, that brings me to innovation. We have to think of innovative approaches, but as Gabby was saying, you know, you can have NGOs working with the youth and helping them, because if there are youth peer counselors, then they'll probably listen to each other, but they're not going to listen to their parents or somebody else. So innovation is needed. I know in India, where I originally come from, there has been a big push towards telepsychiatry. And so the country has set up a whole platform, telemedicine platform, making it easier for community health workers to initially diagnose mental health issues and then connect people to the telepsychiatry platform. So the world of innovation and using digital technology for good mental health is also growing, and so we need to watch that. Great, so now let's shift to New York. New York is coming up, and we are all unhappy with the political declaration. Something is missing, so let me turn to our panelists, and each of you have a minute to tell us what is your wish list for the declaration that is going to be adopted in New York. Carolyn, over to you.
Okay, my wish list. Well, so based on what we know from data, I would like to point out that, of course, there's a worrying trend, but there are windows of opportunity. So, and we haven't been talking about that a lot. So, I think what has the potential to help now to prevent mental diseases or the development of mental diseases is to listen carefully to the young people, to talk to them, to give them the possibility to tell us what they need, what they worry about, and just give them the opportunity in general, and especially for them with lived experience. Another wish would be to push forward also this proactive mental health approach and the mental health and all policies strategy even more, and extend the low threshold prompt support services, because there are a lot of young people out there, they are experiencing stigma, and this discourages them for reaching out, for seeking help.
Thank you. Yes, I agree that listen to the voices of those that are on the end point, definitely. And I believe a focus on multi-sector partnership, as much as this is a big word, I still believe that partnerships are the way to go in terms of finding solutions.
Yeah, so I will actually be in New York as well, and I will keep advocating. So the three things that are really important to me with the political declaration are, on the one hand, what we talked about earlier, really highlighting being even more inclusive when it comes to NCDs and mental health, really looking very specifically for around serious mental illness, but also other conditions that are currently unmentioned, such as liver disease, kidney disease. I want to have a more inclusive and therefore stronger declaration. The second aspect is, of course, again, like the commitment of national governments really to pull that through and implement. And when it comes to the implementation, we as Boehringer are actually currently in a process of co-creation, working on a white paper that we want to launch in New York just in advance of the political declaration, where we're looking at the implementation at national level and highlighting the need to work with people from civil society and especially people with lived experience, involving them in the implementation at national level. So this is what we will be doing in New York, and of course I would very strongly invite anyone, to connect on this who will also be there, because I think our voices are stronger together. Yes, I'm sitting here today as I think the only private sector speaker in the entire day, but I do think that together as a community here of global health, we need to show up.
Perfect. Thank you so much. And I just wanted to mention that the NCD community in the Global Health Hub Germany is currently working on a policy note that is guiding our engagement with the German government on the high-level meeting, the political declaration, and beyond. I'm somebody who likes to focus on implementation, so I just look at the political declaration as something which will be adopted in New York, but will hopefully give us all space to work on implementation on the ground. So with that, I thank you very much for a wonderful panel. Thank you to my wonderful panelists, and I wish you a lot of fun at the next session on the pre-launch of the One Health Lancet Commission. Thank you very much.